Hi there, my name is Autumn Sanderson, and this is video 2 for respiratory 2480 on pulmonary function testing. So, how we interpret the data from PFT. So, as we discussed in the first PowerPoint video, we get a lot of various values, and they cannot all be looked at individually. They all have to be looked at together so that we can see the whole data. So we talked about our forced vital capacity, that strong force exhale after a deep breath. And so a normal range is going to be 80 to 120% of predicted. So what is predicted? What does that mean? Going back to our previous PowerPoint, we talked about how our predicted values are based on several different factors that can include our age, race, ethnicity, our sex, etc. So our forced vital capacity, normal, 80 to 120% of predicted. If the FVC is decreased, this could mean one of two things: obstructive, or the patient might just be normal. It's going to depend on the patient. It could also be restrictive if there is a decrease in the FVC, or it could be both. Patients can have both restrictive and obstructive disorders. So, our FVC could mean a lot of things on its own. So, if a patient's FVC is decreased, it's worth taking a closer look at the other data because something might be going on. Our FEV1, so is the predicted amount, again, is going to be based off of that data. And a normal amount for an FEV1 on a patient is going to be anywhere from 80 to 120% of predicted, just like our FVC. But if the FEV1 is decreased, this could mean obstruction, restriction, or normal. Or it could also mean mixed between both. So very similar to FVC. So how do we differentiate those? With our FEV 1%. Normal or greater for FEV 1%, normal or greater than or equal to 70% of predictive. Or a decrease could mean obstructive or mixed. If the FEV 1% is increased, or if it's normal, this could be a restrictive process. So here we have a chart that is going to help us identify what a patient's values mean and what values we should look to next if their values are out of range, and how this leads to whether or not a patient has a restrictive airway or an obstructive airway. So as you can see at the top, if that ratio is less than or equal to 70%, then we have an obstructive pattern going on most likely. If that patient's FEV1 FVC ratio is not less than or equal to 70%, the patient could be normal. They could be totally fine, or they could be restrictive. We can't just take that ratio as being normal, thinking that they might be normal when they could have an FVC that is greater than or equal to 80%. That would then tell us, okay, not normal, we have a restrictive pattern. And if that is the case, we'll look at our total lung capacity, our TLC. If it is greater than or equal to 80%, normal, cool, we're good. Yes, we saw that restrictive pattern, but the patient's lungs are good. But if the patient's TLC is less than or equal to 80%, restrictive airway, then we want to look at our DLCO. If that itself is less than or equal to 70%, patient might have interstitial lung disease. If it's not, but all those other parameters fall in line, they might be a patient who has a neuromuscular disorder. And then on the other side, you see more of patients who have an obstructive pattern listed over there on the right, or what it looks like if a patient has a mixed obstructive and restrictive disorder. Yes, Their ratio is less than or equal to 70%. They've got the obstructive pattern, and their FVC is less than or equal to 80%, and their TLC is less than or equal to 80%. They've got both a mixed and an obstructive restriction. It does note there that it's not possible to accurately quantify the severity of the obstructive ventilatory defect in a mixed pattern, but it is possible to use our TLC to quantify the severity of this in these cases. Now, levels of severity. So we do have a PFT severity scale, and for the severity of a PFT, we're going to look at the FEV 1%, and these levels are based on the FEV percent predicted. So a normal PFT in the 80 to 100% range, normal. Mild, we're going to be leaning towards our lower end to 65%, and our moderate disorder is going to be 50 to 64%, and our severe disorder is going to be 35 to 49%. And very severe, you have a less than 35% of predicted on the severity scale, you in trouble. You got a very severe disorder. And so we use this severity scale, especially in our obstructive diseases like COPD patients, to help classify the degree of airflow limitation based on those measurements, like our FEV1. With our severity scale, we are going to strictly be looking at our FEV1 percentage of predicted. So less than 70% of that indicates a mild obstructive disorder. 60 to 69% is going to be a moderate obstructive disorder. 50 to 59% moderately severe. 35 to 49 severe. And again, like we said before, less than 35% of predicted very, very severe. And that is the end of video 2.